Hi everyone, I'm Tasneem back here with this week's mental health segment brought to you by the LA County Department of Mental Health. I'm back here once again with Alka Bhatt, who's here to talk to us about substance abuse and mental health. So tell us, Alka, how are substance abuse and mental health issues related?
Essentially, when someone has a mental health disorder as well as using drugs or alcohol, they make each other worse. For example, someone suffering depression and using cocaine to cope, when the cocaine wears off, the depressive symptoms get worse. It's a very complex system because it could be environmental. Also, genetics plays a factor. If somebody who has a mental health disorder, which could be depression, anxiety, they may end up using drugs. It may just set them over the edge. And so what happens is, oftentimes when you're using drugs or alcohol, when you have depression or anxiety or bipolar disorder, you end up making really poor choices. And this could lead to legal issues. It could get you arrested. You make really poor decisions. It could cause a lot of conflict in your relationships with your family, which could lead to even more isolation. Also, the other piece of it that's huge is the withdrawal effects. So for example, with alcohol, you could feel nauseous, you could have the shakes, you could start seeing things that are not there. It could lead to you having to go to the hospital.
So what steps can someone take if they or a loved one is struggling with substance abuse issues?
The first step is admitting that there's a problem. Denial is very common among those who are dealing with substance abuse issues, as well as experiencing mental health symptoms. So the first step is always to admit that you have a problem. More importantly, among our South Asian community, we want to make sure that we're getting the support from family members, acknowledging that there is a problem when someone reaches out to admit that there is a problem. The second piece is reaching out for help. And that's where we would want to discuss with our loved ones what we're experiencing and hopefully get the support that we need to get us into treatment. The next step is really asking for help. And this is seeking out professional assistance, which will include a clear assessment to determine what are the mental health symptoms. It's very important that during the time that you are receiving treatment that you are not using, because the problem is then it's really hard for the doctor, if they're prescribing medications, it won't be as effective, as well as therapy. But definitely start with asking for help and getting that assessment. So there are effective treatments such as prolonged exposure therapy that can really improve the PTSD symptoms, as well as work on the underlying issue and help you with coping skills. And lastly, there are support groups such as Alcoholics Anonymous, Narcotics Anonymous, NA groups that you could get supports from people that may have gone through what you're going through and encouraging each other to not use.
So is recovery from substance abuse possible?
Yes, there's always hope. Both substance abuse and mental health conditions are treatable conditions. With a little bit of courage and a lot of hard work, you could get through this. It's really important to note that relapse is part of the process. And it may take 3-4 times, it may even take 7 times, but symptoms definitely improve and people do get better. So it's really important, keep supporting your loved ones if they are suffering from a mental health diagnosis or some substance abuse. As long as they have that support, they actually way better in research. So this is why it's so important for our South Asian community to get together, acknowledge that we have this problem, and to really encourage our loved ones to seek help.
If you or someone you care about needs help, call the Los Angeles County Department of Mental Health 24/7 helpline at 1-800-854-7771. Your call is safe and confidential.